So, if you're experiencing piriformis syndrome, what's happening is that the piriformis is overperforming, it's overachieving. It's doing the job of other muscles, which are taking a break. And piriformis is the first to volunteer and pick up the slack for some of your hip muscles and or your lower back muscles. So let's talk about what that might look like. I'm going to show you also a really great stretch that's going to help release it immediately. And so one of the first things, this happens, it's very common in athletes, is that there's a position in the foot. The ligaments in the ankle or the foot could be misfiring. And so the piriformis will then kind of lock down. And that's when you experience piriformis syndrome, when you go upstairs, perhaps, climb a lot of stairs, or maybe after a run or a hike, something like that. So let's explore and see if it is in fact coming from the foot. So come into a seated position, preferably one where you might experience your piriformis syndrome. So sitting in a chair, the sofa, wherever. And slowly get up out of the chair and slowly sit back down. Now, if you don't experience your piriformis syndrome here, you might experience it somewhere else in your life, in your daily life. And you can go and do that thing and kind of translate this into your experience or your thing that you suspect might be causing it. Now, if I have it on the left side, instead of sitting down with my feet parallel, I'm putting the left one in front and I'm stepping forward with it slightly. This will create a situation where the right side is actually going to be doing most of the work here. And compare this to when you had your feet parallel. So now you might have a little bit of a handle on whether or not it's coming from there. Let's see. Another thing that happens is that some of the hip muscles, and this could be going on regardless if you have something going on with your foot or not. There's some muscles in the hip that are likely that they're not working as well as they should be working. One of them is glute medius, right here. It's on the outside of the hip. It is the most commonly underperforming muscle in the lower body. And so even in athletes that you would never suspect have weakness anywhere, will be weak in this muscle relative to their other muscles, and this is very common. The other muscle that is most closely kind of related to and opposing this piriformis is psoas, which is a hip flexor muscle. It flexes the hip. So those two muscles, when you strengthen them, piriformis will have a tendency to let go. So if I do have some videos that actually teach you how to strengthen those in isolation, so that they're like your other muscles, your piriformis can't. It's just unable to do the work for that other muscle. So that's why the positions and biomechanics are a little different than what you see at the gym or what you see in a yoga class, because we have to isolate muscles in order to get them to perform correctly. So I'm going to show you now the best stretch for piriformis that I know, and it's called Fosse. And what makes it great is that it's a tensile stretch. So you, at the same time that you're lengthening the muscle, you're also strengthening the muscle. So here it is. Come into a standing position. This is what I call Fosse. We're going to start by standing with your weight in your heels and turn one foot out at a 45-degree angle. Stand on it. Support yourself with the foot in the back. You can prop that heel up. But keep your chest lifted. Keep about 70% of your weight in that front foot. And then bend your knees, bend your knees, bend your knees more. You may bend your knees enough to put your fingertips on the floor. If not, you can use a block, or you can place your right elbow on your right knee. And we're going to twist to the right and hold for 3 breaths, long breaths, maybe even 5. And then we'll gently step out and do the same to the other side. It looks kind of like you're taking a bow, like a big, deep curtsy. And that's why I call it Fosse. Bend the knees a ton. Sit into the hip, like you're kind of scooping out from the inside of the hip. Don't forget to breathe and relax. And I would repeat this a couple more times on each side. And then you're welcome to come out. Anytime your piriformis feels tight, try that stretch. We're going to do this one more time together. The knees bend, the knees bend, the knees bend. You don't have to bend so far that it's painful. So I want you to realize, we don't want to keep going into these pain patterns. You want to be nice and gentle with your body, but you also want to give your body what it needs at the same time. Really sit back into that hip, twist to your left, or on the left side again. When I hold these, I usually count long, smooth breaths. It tends to keep me peaceful inside while I'm doing some hard work on the outside. Then take a little walk around and just feel your hips. So, and when you learn what's causing the problem, which muscles aren't functioning quite as well as you'd like them to, and you're consistent with reprogramming your movement, so to speak, you can eliminate the problem within weeks. It's a retraining process, kind of a relearning for your body on how your muscles are interacting with each other, how your muscles are shifting their weight, how your muscles are, working to, most of the time, it's really great to understand what's happening when you're emptying the dishwasher and doing the laundry. These are everyday things that you're doing that maybe, if you did them a little bit differently, you'd stop using your piriformis so much and be able to use some of those muscles that you want to be working instead, to unwind those pain patterns and create new freedom patterns in your body.